Hello there, my name is Kamran Bhopal. I'm here with another session for recurrent urinary tract infection history taking station, and the question usually presents as the patient is having recurrent urinary tract infections, take a history, or something in those lines. It's quite straightforward. The way I have prepared the history, or I take a urinary tract infection history, is as follows. I will review the GP letter and previous urine cultures or any imaging available, and also check the patient's understanding. I would see this patient in the routine outpatients clinic, and in my assessment I will focus on establishing whether the patient has an isolated or a recurrent UTI, whether the patient's got cystitis or pyelonephritis, and whether this is a complicated infection or not. I will take a focus history of the urinary tract infection, asking about dysuria, cloudy or foul smelling urine, fevers or flank pain. I would then ask for the frequency of these urinary tract infections and match them with the cultures available on the system and how they have been treated. I would then ask for any previous hospital admissions for pyelonephritis or UTIs, and triggers such as sexual intercourse, travel, constipation or reduced fluid intake. I would then take a history of lower urinary tract symptoms, asking for storage and voiding symptoms, and also asking if there is any incontinence and classifying it if it is present. I will also ask about sexual history, including vaginal discharge, itching and symptoms within the partner. I would rule out any red flags such as weight loss, anorexia and hematuria, and risk stratify the UTI as urological causes such as urological instrumentation, catheterization or any other urological procedures, gynecological or obstetric, including number of children, vaginal deliveries, estrogen status. I would also ask about other medical causes such as neurological disease, diabetes mellitus, or any other medical reason why the patient may be having UTIs. Asking about medication such as oral contraceptive pills, any antibiotics that are being taken or have been tried, any allergies, family history of urological cancer or recurrent UTIs, since certain ABO blood group types are more prone to having urinary tract infections, and social history, asking about smoking, alcohol intake, very importantly fluid intake, diet, bowel function, performance status, general fitness, and check the patient's quality of life and how these recurrent UTIs are affecting the patient's quality of life. And I would close the history asking about the ideas, concerns, and expectations of the patient. This is how I would structure my UTI history, and you can set it up the way you want to do it, but make sure that you've included the salient points. Triggers are important, sexual history is important, lower urinary tract symptoms, red flags as you ask in all histories, but also some medications, OCPs cause UTIs, what antibiotics have been tried, and risk stratifying is quite important in UTI. It's a very broad topic, but this is how I've structured it, and this makes me not miss any point. I wish you all the best, and I hope all of you get an NT, and see you next time.